We will be talking about the anatomy and functions of the heart chambers. As you may know, the heart is a vital organ in the body that pumps blood throughout the body. The heart is made up of 4 chambers: 2 atria and 2 ventricles. The right atrium and right ventricle are responsible for pumping blood to the lungs for oxygenation, while the left atrium and left ventricle pump oxygenated blood to the rest of the body. Let's start by looking at the right side of the heart. The right atrium is one of the 4 chambers of the heart and is located at the top of the heart. It receives deoxygenated blood from the body through 2 main veins, the superior vena cava and the inferior vena cava. The superior vena cava brings deoxygenated blood from the upper body, while the inferior vena cava brings deoxygenated blood from the lower body. Once the deoxygenated blood enters the right atrium, it passes through the tricuspid valve and into the right ventricle. The tricuspid valve is made up of 3 flaps or cusps that open and close to allow blood to flow in one direction. The right ventricle is located at the bottom of the heart and is responsible for pumping the deoxygenated blood to the lungs through the pulmonary artery. The pulmonary artery carries the deoxygenated blood to the lungs, where it gets oxygenated and releases carbon dioxide. The left atrium is the chamber located on the left side of the heart, above the left ventricle. Its main function is to receive oxygenated blood from the lungs through 4 pulmonary veins, 2 from the left lung and 2 from the right lung. Once the oxygenated blood enters the left atrium, it passes through the mitral valve and into the left ventricle. The mitral valve, also known as the bicuspid valve, is located between the left atrium and the left ventricle. It is made up of 2 flaps or cusps that open and close to allow blood to flow in one direction. The left ventricle is the strongest chamber in the heart and is responsible for pumping the oxygenated blood to the rest of the body through the aorta. The aorta is the largest artery in the body and carries oxygenated blood from the left ventricle to the rest of the body. The left ventricle is so powerful that it can pump blood throughout the entire body, with the exception of the lungs. It's important to note that the heart's chambers work together in a coordinated fashion to pump blood throughout the body. When the heart beats, the atria contract first, pushing blood into the ventricles. The ventricles then contract, pushing blood out of the heart. Overall, understanding the anatomy and functions of the heart chambers is essential for maintaining a healthy heart and preventing heart disease. A healthy heart means a healthy body, so make sure to take care of your heart by eating a balanced diet, exercising regularly, and visiting your doctor for regular checkups. Thanks for watching, and we hope you learned something new today.